Hello everyone, welcome to my channel. I am Vives with me. Here, as per the promise made with you, I am here with you with the subject of the ophthalmology. Okay, so here we will complete from the very basics, okay, to the level which is required in our professional examinations and to develop the understanding of the subject. Okay, so this is the first video of the ophthalmology. In this, I will tell you the from the very basics that you even do not require to just put out your books of your previous profs. Okay, so here in the ophthalmology basically means the study of the eye. Okay, so here we will be basically dealing with the eye. So in the eye, to look at the eye, as I have drawn here the picture, which is looking something like a ghost. Okay, it is showing the two orbits. This much you must know, that the eye is structure which is lodged inside orbit. Okay, ठीक है, orbit is a bony case as you all know. Okay, so we have two orbits. In the orbit, what you will see, that the orbit is directed medially, something like this. Okay, orbit is directed medially, something like this. Suppose this is your nose, and then the orbit will be directed towards it. Okay, because in between the two orbits you have a nose. Okay, so now what you will see, that the orbit is being directed, as you can well appreciate in this. Later I will also show you the model. Okay, so now in this is the orbit. I have extracted this orbit. Okay, I have just plucked it out and just showing to you. So as you will see that the orbit is pyramidal in shape. So the pyramid consists of the apex and the base, the apex and the base. Okay, now what you will see, and the walls. Okay, so apex is directed backwards towards the back of your head, and the base of the orbit is in front. Okay, through which you look at your eyes. Yes, so this is the base forming the orbital margin. So now the walls of this pyramid are known as the roof, the superior wall. The inferior one is known as the floor, while the lateral one is known as the lateral wall, while the medial one is known as the medial wall. Okay, so now we will jump onto the orbital margin, and in the orbital margin we will see that what is the orbital margin. So this, you can well appreciate this area, that this is the area surrounding the, in which the eye is lodged, forming the boundary of the base of the pyramid, that is the orbit. Okay, so this is basically formed by these three bones known as the frontal bone, zygomatic bone and the maxilla bone. Now superiorly you can well appreciate it. It is formed mainly by the frontal bone. So here it is formed by the frontal bone, the orbital margin. Then we will jump laterally. So laterally it is formed by the frontal bone, a part of frontal bone. You have to just say only this much. Okay, in the subject of the ophthalmology, later details will be discussed in the anatomy. Okay, so in the ophthalmology, this is also the lateral wall is somehow formed by a small part of the frontal bone, and rest it is formed by the zygomatic bone. Okay, so this is frontal bone. I will ask you later. This is frontal bone, this is also frontal bone, this is zygomatic bone. Then inferiorly it is formed by zygomatic bone mainly, but on a medial aspect a bit of maxilla bone is there. Okay, so here the bit of maxilla bone is there. Then the medially it is formed by the maxilla bone. Okay, so now we will see it here for a better understanding. You will speak with me. This is what? Frontal bone, then frontal bone, then zygomatic bone, then zygomatic bone, then maxilla bone, then maxilla bone. Okay, so yes, this was that much simple. So this is the orbital margin. Okay, representing the boundaries of base of orbit. Okay, because apex is directed inwards, as you can see, as you can well appreciate, this area, this is the apex of the orbit, directed medially and inwards, medially and inwards. From this eye also it will be directed medially and inwards. Okay, so now we will reach to the walls. as we have discussed this margin, okay, this base, this orbital margins. So now we will jump on the walls, that what are the bones. As we all know that this is a bony cage, orbit is a bony cage in which the eyeball is lodged, okay, and the contents of the eye is lodged. So this is formed by the seven bones. Now what are these seven bones and how these forms are, this is something here. So roof is formed by, this is the roof, so this is the roof. So roof is formed by the frontal bone, the sphenoid bone. The sphenoid bone, frontal bone you can see along with the orbital margin, yes, and the next is the sphenoid bone, okay. Then we will reach on the floor. So the floor, so here the new bone is only the sphenoid bone because the frontal bone was already present in the orbital margin, okay. Margin is something which you can appreciate from outside, okay, while the wall is visible here. This is the wall, this is the roof, okay, this is the floor, this is the medial wall, this is the lateral wall, and this is the margin. So in the margin, as we have discussed here, now this is roof. So in the roof is formed by the frontal bone and the sphenoid bone, while the floor is formed by the palatine bone, a new bone, and the zygomatic bone and the maxilla bone we have already seen in this, the zygomatic bone and the maxilla bone. Now we will jump laterally. So in the lateral wall you will see the lacrimal bone and the ethmoidal bone, which are the new bones, and the maxilla we have already seen. Sorry, I just need to correct it. Yes, it is medial wall, it is lateral wall. Okay. So medially what you will see the lacrimal bone, ethmoidal bone, and the maxilla. Maxilla was already present as we have seen here, okay. Then in the lateral wall you will see sphenoid and the zygomatic bone, sphenoid and the zygomatic bone, okay, laterally. Got it? So laterally sphenoid and the zygomatic bone. As we have already seen that the zygomatic bone was already present. Only the sphenoid bone is the new bone. Thus, so should I need to write it separately? Okay, I will do it for you. That what are the names of the seven bones which participate in the formation of the whole of the orbit? Okay. So you will speak along with me. These are frontal bone, okay, one, another, yes, these three bones, sphenoid bone, okay. After the sphenoid bone, the next bone to consider is zygomatic bone, then palatine bone, then maxilla bone. After the maxilla bone, lacrimal bone, and the ethmoidal bone. Now you might be thinking that why he is writing with this color. This is something why. The answer is so that you should also write it in a very sequential manner so that you can learn it, okay. Basically we have to see the frontal bone, the zygomatic bone, the maxilla bone, the sphenoid bone, the ethmoid bone, the lacrimal bone, okay, and the palatine bone. So this is the very good sequence to learn about. What is this sequence? Okay, I will just explain it for you. Okay, I will just read it for you. Frontal bone, zygomatic bone, and the maxilla bone, the three bones, okay. Then the next sphenoid bone and the ethmoid bone, the lacrimal bone and the palatine bone, okay. So write it in this sequence so you will be able to learn it in a very well manner, okay. So now from here we will reach the very basic things about the orbit and the main content of the ophthalmology, okay. So here I will use mainly a color, okay. So orbit. Now you will tell. Orbit is pyramidal in shape. Okay, pyramidal in shape. What is the volume of the orbit? So it is around 30 cc or 30 ml volume. What are the main openings of the orbit? So three openings. What are these main three openings in the orbit? These are the superior orbital fissure, inferior orbital fissure, and the optic canal. Now the thing you need to remember in the subject of the ophthalmology is that optic canal, the things which pass through the optic canal is the optic nerve, and along with the optic nerve, central retinal artery. Central retinal artery. Okay, so this was it. Pyramid, orbit is pyramidal in shape, 30 cc volume, 3 openings, superior orbital fissure, inferior orbital fissure, and the optic canal. Now the thing you have to learn is that the optic canal gives the passage for the optic nerve and the central retinal artery along with the optic nerve. Okay, so this was all about the basics of the orbit. Okay, earlier I have explained, and this one. Then we will reach to the eyeball. So now we will reach to the eyeball. Now what I will explain, we will start it in the next video. Okay, thank you, have a good day, bye bye, like, share and subscribe my channel.